Meanwhile, Donald Trump has been under the pump for his lukewarm response to the coronavirus's outbreak. Now, the panic has hit one of his beloved talking points, the economy. So, to allay fears, the president made a primetime address to the nation this morning, and in unprecedented move, he announced the suspension of all air travel, in fact, from Europe to the United States. Listen in.
I have decided to take several strong but necessary actions to protect the health and well-being of all Americans. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. These restrictions will also not apply to the United Kingdom.
Right, far-reaching restrictions being put all over the world, particularly in the United States now, as well as here in India. Now, we're being joined by Peter Lee, an associate professor at the University of Houston, live from Houston at this point. Peter Lee, thanks very much for talking to us this morning. Now, coronavirus has now been declared a pandemic, with fears that it will only become worse, with a higher intensity as the winter comes. How do you see this outbreak panning out?
Well, it's very hard to say at the moment, but we have seen that the epidemic has spread in great intensity and speed, across Europe and, Southeast Asia and also South Asia. So I would say I would take a cautionary note to say that as long as these countries which are impacted, right, take strong measures, right, stop, internal travel and external travel, and contain the disease within the border, we hope to see that the number of infections will go down. But if countries are not taking strong enough measures and still allow cross-border travels, then the time required for contain the disease would be longer.
Right. So you certainly feel that the widespread travel bans imposed by the US, India, and other nations will certainly help stop and contain the virus's outbreak.
Yes, absolutely. But of course, if the travel ban could have been imposed earlier, then that would be probably a little bit more helpful. But I guess at this moment, because there are so many things we don't know about the epidemic, so that's the only measure that could be effective. But I can give you one example why this travel ban is important. If you look at North Korea, now North Korea is the country which is so close to China and has such an intimate economic relations with China. But because North Korea started to close off all the travels between the two countries, and we have not had a single case in North Korea yet. So the travel ban is important, but what's more important is that the travel ban should have been imposed earlier. But of course, we have a lot to learn about the epidemic. So that's why a lot of countries are taking a wait-and-see attitude until they decide now, we cannot wait anymore. So yes, travel ban is important.
Absolutely. In fact, the WHO also said just last week that this is no longer a drill and countries need to wake up to the reality. But Professor Lee, then why are we seeing such a surge in deaths in some countries, for example, Italy?
Italy was a hard hit in the world and now become, I believe, the second largest country in terms of infections, number of infections and deaths. Now, the issue is, Italy has been responding a little bit too late. That's my, judgment. Now, there are a lot of, issues why, countries respond not too quickly. There were a lot of misperceptions about the illness. And one of the misperceptions was that this was, Asian, epidemic, impacting Asians, particularly Chinese. So if that kind of misperception continues to go on, then that would impact, that would object, right? That would, obstruct, actions taken by the government. And of course, this epidemic is new. There is no, no remedy no drug that can can
Right.
be used to address this epidemic. And of course, when you have a sudden outbreak of this epidemic, so many patients, your public health system is pushed to the maximum stress.
Right, absolutely. And finally then, Professor Lee, with such an unprecedented shutdown globally, will this also have far-reaching impact on the economy, global economy?
Absolutely. There have already a lot of impact to, for example, the Chinese economy. Now trade has been slowing down, and they were also talking different countries, especially countries with intimate relations, economic relations with China, have been talking about they should diversify the source of supplies because the supply chain has been impacted, and also need to diversify the markets. But we understand today is a globalized economy. When every country, all the countries are interconnected with each other, disease has become also globalized. So how can you solve the problem? At the same time, you want more interdependent, more integrated economic relations, but then you don't want, the impact of epidemic, cross national border. But I would say yes, there would be impact on global economy, for the run. So people have to come up with a solution. How can we,
Right.
sustain global economy and, resisting and reducing the impact of epidemics?
Well, absolutely. Professor Peter Lee, thanks very much indeed for joining us this morning and sharing your thoughts on what the impact of this has been, both globally in terms of the economy and, of course, in terms of the illness spreading further. Thanks for that.